one from Adult Nursing Blended course, and this is module BLN103. I'm going to talk to you today about breastfeeding as a health promotion issue, which I'm really pleased to be able to do because there was so much stuff I wanted to talk about that there wasn't room for in the essay. Okay, so breastfeeding as a public health issue. This is our issue. Sunderland compares poorly to the national. 74.5% initiation rate nationally, 48% locally, 48% in Sunderland, which is not good. But at 6 to 8 weeks, we're still breastfeeding. Nationally, it's dropped to 46%, but in Sunderland, it's dropped to 25.9%. That's a quarter of people breastfeeding at the 6 to 8 week mark. Sunderland to look at as an area to focus on for health improvement is a place which has high levels of deprivation. It ranks 27th out of 153 local authorities. We can see the little area of Sunderland when it's blown up to a larger region there has lots of the dark blue, showing that although there are some more affluent wards, it contains some of the wards that are in the most deprived decile nationally. We know that deprivation and health inequalities go hand in hand from Marmot's report and his follow-up 10 years later, that a sliding gradient, that relatively the more deprivation is, the more health inequalities there are. In Sunderland, a healthy life expectancy for a woman is 56.5 years, which is a long way away from the 72 years of the best case scenario. The context of Sunderland is one that this report here in 2020 found that there were long-standing generational attitudes where some of the respondents' parents didn't like the idea of breastfeeding. It goes back to the 1900s, turn of the century, when everybody was breastfeeding, and then there was the advent of technological advances, commercialism, capitalism, women going to work, formula becoming much more readily available, and it was advertised as the best for children, as we can see there in this Cow and Gate advert, and it took off. It sold, and breastfeeding reached its nadir in 1972. So this is where we see global policy kicking in with the code coming from the World Health Organization. The code is there to try to have governing policy over the promotion of formula above breastfeeding. They then collaborated with UNICEF to create the Baby Friendly Initiative, which came to the UK in 1994, which was an accreditation that local health authorities can work towards, which informs our national policy, which is, if you look in the NHS 2019 plan, it talks of raising awareness of the health benefits and promoting it as something which has long-term health benefits. In public health nursing, we are uniquely placed to be able to promote to the community, to think of community health on a larger scale as well as on the individual scale. When we're talking about community, it can be to do with infection prevention control, it can be to do with reportable, notifiable diseases and things that are communicable. There are some infections and viruses which can be passed on through breastfeeding, things like CMV, HLTV, rare cases of strep B and Staph aureus and listeria, but they are rare, and the research says that the benefits far outweigh the risks. HIV had historically been the exception to this, but there was a study in 2017 by BISPO, which was followed up by more research in 2022 by YO, that found that under antiretroviral cover, there was a reduced risk of transmission postnatally, and that a 3 to 4 fold decreased risk over the 6-month feed when compared to mixed feeding. So on a community scale, we can look at breastfeeding as something which can be promoted as low risk, reduced risk, high benefit. So why are we looking to promote this? We're looking because the rates are already low. We can see that. We've got our bar chart here that shows that the most healthy behaviour local authority areas nationally, up in the greens, have 96% of babies first feed being breast milk. and we go all the way down through the colours to red, fourth from bottom, Sunderland, and that's the 48% number that we have here. We would like to be able to promote breastfeeding because the health outcomes are, the benefits are numerous. We've got a reduced risk of gastroenteritis, respiratory disease, breast cancer, infection, diabetes, asthma, heart disease, obesity, sudden infant death syndrome, leukemia, sepsis. It promotes brain development, protects against postnatal depression, multiple cancers, and heart disease and type 2 diabetes. And I've got a list of referenced papers there that provide all that supporting evidence. All of these health outcomes can make the impact on the individual's life, their biological health, with reduced risk of things like asthma and diabetes. It can impact on their psychological health with reduced risk of postnatal depression. It can improve on the social health with better bonding and better cognitive development. So it can be something with better outcomes on the whole, for the whole person. That is why we want to do it. How is it being done? Well, we know the national policy in 2019 was promoting breastfeeding. The NHS new 10-year plan 2025 has a phrase of moving from bricks to clicks, and it has no explicit commitment to anything to do with breastfeeding, unfortunately. The local policy is echoing that. It says it will work towards UNICEF baby-friendly accreditation, which is this creation of the baby-friendly Sunderland scheme, where a lot of venues are being invited to partake in being welcoming to breastfeeding. On top of that, they will use findings and recommendations from the city's infant feeding research, which is this one from 2020, and the behavioural insights, which is this one from 2022, to increase breastfeeding rates through digital support. The digital support they mention is this BFF, Breastfeeding Friend app, which was a PHE app, which has since been superseded by lots of other ones. They trialled this app, and then the report, the behavioural insights report, came back with its findings. The 2020 report, what does that say? 2021 on Sunderland infant feeding says that the respondents would like more intensive support, regular proactive visits, and consistent balanced information, because there's a lot of myths out there. It said, this report stated that there were long-standing generational attitudes in Sunderland, which we know, going off its context. The 2022 report said that using this tool found that the improvement of using the tool was not statistically significant. It said there was lack of support. Its respondents felt that the regular visits were helpful, and it recommends in its findings that it would continue research into more effective ways to change attitudes on self-efficacy. So, is local policy working? Is it reflecting national policy? Yes. Is it responding to what the report is recommending? I would argue it isn't. So how are we going to change things? Well, this is where being a public health nurse can be useful, because this is when we talk about the macro scale, going back down to micro scale. Being able to apply these things to the individual means we can have the research, we can have the knowledge, we can be equipped with the information, the reliable, consistent information that our respondents want, to be able to provide evidence-based research, to be able to provide people with the information about the health benefits, why it is good for them. We can use our behaviour change models. We have got Engel's bio-psychosocial model, where we can look at the person's physical health, how this can benefit them physically, their coping skills, do they need more support? Socially, their peers, do they need more peer support, which is where we can lean into the breastfeeding friendly Sunderland venue scheme. We can lean on Prochaska di Clemente's trans-theoretical theory stages of change model, so that we can understand that we're not just there for the action phase, but we're there for the maintenance when things are difficult. We can also think of Purnell's cultural competence model, where we can think about the person's their background, their family, their religion, their beliefs, and that can then lead into self-efficacy and how we can improve that. It's things like being able to provide a safe space, such as somewhere where it's safe to feed, active listening, and empowerment and the respect, because ultimately it is the lady's choice of if she wants to feed or not, to be able to respect that, but just to provide the information, to dispel myths, be reliable, consistent, and provide that face-to-face contact that people clearly want.